Hello everyone. Today we will see child health nursing second year GNM important question for the examination. Today we will see 50 questions. 4 marks or 5 marks they'll ask this 50 questions. If you study this one only, it will be helpful for to get 50 marks. First we will see midday meal program. Midday meal program, you want to write the definition and what and all will come under the midday meal program you want to write. Next, play and its importance. Play is a repeated question. Frequently they are asking the play. They'll ask define definition you write, then types of play and importance of play you want to study. Next, internationally accepted the rights of the child. This also repeatedly they are asking this question. Play and this international accepted rights of the child is repeatedly they are asking. Then hearing impairment, then ICDS scheme, then ABGA score and phototherapy. Phototherapy is repeatedly 4, 5, 6 question papers they are asking the phototherapy. Then national immunization schedule. The national immunization schedule also repeated question in the pediatric paper. Next is Down syndrome. Down syndrome also repeatedly they are asking. 4, 3 question papers we seen this one, Down syndrome. Then psychosexual development, this also is repeatedly they are asking. Then cancer care, then low birth weight babies, malnutrition, leukemia also is repeatedly they are asking this question, leukemia. Next we will see 15th question. First, breastfeeding, advantages of breastfeeding and techniques of the breastfeeding they are asking this one. Then arterial septal defect also is important question. Cleft lip and cleft palate is repeatedly they are asking the cleft lip and cleft palate question. Then under-thigh clinic, the under-thigh clinic also is repeated question. Then reflux in newborn, reflux in the newborn also they are asking. Then concept of preventive pediatrics, then weaning, then child reaction to hospitalization. Child reaction to hospitalization is repeatedly they are asking. General delinquency also repeatedly they are asking. Then enuresis, child abuse, cerebral palsy, proterotic stenosis. Then encephalitis is repeatedly they are asking. Then anemia, then malabsorption syndrome. Malabsorption syndrome sometimes they are asking. Then general diabetes, repeatedly they are asking general diabetes. Then mental resuscitation sometimes they are asking, but repeatedly they are asking in the essay questions they are asking this one. Osteomyelitis and anorexia nervosa. This anorexia nervosa also 2, 3 question papers I saw this one, anorexia nervosa. Then poliomyelitis and FTT. Their poliomyelitis also there, how they are asking means prevention of poliomyelitis and prevention of osteomyelitis, like that only they are asking. Directly they won't ask like this. The prevention and management, nursing care, like that only they are asking this one. Then oxygen administration. Oxygen administration also 2, 3 question papers I see in the oxygen administration. Then role of pediatric nurse in the child care. Then fracture, hearing impairment, again I written the same thing. Okay, sorry. Next we will see preventive measures of malaria resistance also is repeatedly they are asking. Then colostomy care for the child also repeated question this one. Then trends of pediatric child also repeated question. Then jaundice also they are asking. Then assessment of newborn, it is repeatedly they are asking this assessment of newborn of the child. Then warm infestation also repeated they are asking this one. Informative analysis also sometimes they are asking, and it's also important once you go through it. Then care of handicapped children is repeatedly they are asking, and factors affecting the growth and development, and CPR for the pediatric. Next, last is prevention of accidents. Repeatedly they are asking the prevention of accident. And again we will go for the answer the following. That means essay questions we will go. In that first one is define TOF. TO means tetralogy of fallot. Is repeated question in the pediatric paper. Discuss the causes and type and sign and symptoms. Then explain the management of TOF. Next, second question is define tracheoesophageal fistulas. Repeatedly they are asking this question, and causes and signs and symptoms and management. Then third one is nephrotic syndrome, also repeatedly they are asking this one. explain the causes and signs and symptoms and diagnosis of, and explain the management of nephrotic syndrome. Then fourth question, this is important. The second unit fully it will become growth and development. Growth and development is compulsory question they are asking in the pediatric. Define growth and development, principles of growth and development, and stages of growth and development. Even factors affecting growth and development also is important. To study this one. Repeated question. Next fifth one is define neonatal jaundice. Neonatal jaundice also repeatedly they are asking. The causes and signs and symptoms of management. Then pneumonia. Pneumonia also is important. Then spina bifida. Spina bifida is so important question only. Then hydrocephalus, very important question. Repeatedly they are asking this question, hydrocephalus, and causes and signs and symptom and diagnosis and management of hydrocephalus. Next is rheumatic fever also is important. Then meningitis. Meningitis repeatedly they are asking. Then congenital anomalies. Then head injury. Then tonsillitis. Tonsillitis is repeatedly they are asking this question. Define tonsillitis causes and clinical manifestation. Head injury also is important only. Then tonsillitis, because why I am saying repeatedly they are asking the tonsillitis questions. Next tuberculosis. Tuberculosis also important. Clubfoot. Diarrhea is important question in the pediatric. Common question is a common question, diarrhea. That's why it was important. Then congenital heart disease. This was important question. Glomerulonephritis also important question. Then patent ductus artery. It is an important question. 2 or 3 question papers I saw this one. Then preterm babies, this is also important question. So far today we will see about this pediatric important question. Okay, 50 4 mark or 5 marks and long essays. So for this much if you study only you get good score, you can get the pediatric. Okay, thank you. About the child health, what and all the important questions. Okay, so this much if you study only you can score the good marks in the pediatric. Next class we will see. Okay, see you tomorrow.